Hello, my name is Mieke Soens. I'm an anesthesiologist at Brigham and Women's Hospital, and in this brief presentation I will discuss the results of the vital pain ancillary study looking at the effects of vitamin D and omega-3 fatty acids on pain. The anti-inflammatory diet, which includes omega-3 fatty acids and vitamin D, has been promoted for the prevention and treatment of pain. There are several studies that suggest that omega-3 fatty acids reduce pain in patients with rheumatoid arthritis, migraines, and other types of pain. Similarly, oral vitamin D3 has been shown to lead to less pain in patients with musculoskeletal pain. However, large randomized placebo-controlled trials are lacking. The proposed mechanism for the analgesic effect of omega-3 fatty acids is that DHA and EPA are precursors for the specialized pro-resolving mediators, resolvins, protectins, and muresins. These mediators are necessary for the resolution of any acute inflammatory response and have also been shown to have very potent analgesic actions in several animal models of inflammatory as well as neuropathic pain. Vitamin D3 has been shown to decrease cytokine production, inhibit COX-2 expression, and reduce the production of prostaglandin E2. Prostaglandin E2 is the best-known lipid mediator playing a key role in inflammatory pain through actions on both the peripheral and the central nervous system. So taking a look at the design of the main VITAL trial. So the main VITAL trial was a large randomized placebo-controlled trial looking at the effects of vitamin D and omega-3 fatty acids on cardiovascular disease and cancer. For this trial, 25,871 patients, men and women, were enrolled. Men were 50 years and older, and women were 55 and older. Participants were randomized in a 2x2 factorial design with randomization to vitamin D or placebo, and next, dose groups were randomized to omega-3 or placebo. The doses used were 2,000 international units per day for vitamin D, and for omega-3, 1 gram of DHA and EPA per day was used. The median follow-up for the trial was 5.3 years, and results of the main trial were published in the New England Journal of Medicine last year. For the pain ancillary study, pain was assessed using the questions from the 2012 National Health Interview Survey. Namely, we asked, in the last 3 months, how often have you had pain? And thinking about the last time you had pain, how much pain did you actually have? And these questions were asked at the end of the 5-year trial and allowed us to create distinct pain prevalence and severity categories. For example, patients with category 1 pain reported a little pain on some days, while patients with category 3 pain had either a lot of pain on some days or between a little and a lot on most or every day. A total of 19,611 patients provided us with complete pain data at the end of the trial, of which 33% was pain-free, 37% had category 1 pain, 16% category 2 pain, 11% category 3, and 3% category 4 pain. The main results of our study showed that there was no effect of omega-3 fatty acids, at least of 1 gram, on pain severity and pain prevalence category. The odds ratio is 0.99. There was also no effect of vitamin D on pain prevalence and severity. Odds ratio also 0.99. We did see that women were almost twice as likely to report a higher pain category than men. The odds ratio for this was 1.85. We also did have some potentially interesting findings from the subgroup analysis. We did see a potential worsening of pain with vitamin D in African American patients. And this is a very small effect, but nevertheless, the potential differential effect of vitamin D by race warrants further investigation. In addition, we also noticed that the effect of omega-3 fatty acids on pain may have been modified by BMI, where patients with a BMI of less than 25 seem to have a small advantage in the effect of omega-3 on pain. Finally, I would like to end by thanking FAIR, as well as Dr. Manson and the VITAL Group and the Department of Anesthesiology at Brigham and Women's Hospital for their help and support. Thank you.